everybody, welcome back to another video, and this one, it should be a fun video.
You're looking at the wrong camera.
Hey everybody, welcome back to another video, and this one is going to be an interesting one. We're going to be talking about identifying bad behavior. Is it behavioral? Is it coming from a mental, emotional standpoint? Or is the horse in pain and it's coming from a physical state? Brought my wife in here to help me with this. She's a human physical therapist, and she's also a horse physical therapist. She has her equine rehab certification, but she is also teaching the courses there at the University of Tennessee. So she's doing this at a very high level, and I also think she kind of has a sixth sense for this stuff. I've seen her do some amazing things, and when she was a human physical therapist, she was actually working with premature babies who can't speak and say where they're hurting and what's going on, and she was able to read their body language and identify kind of the challenges that they were having. So welcome, Emily Rose.
Thanks for having me.
And tell us, we'll just jump right into it. This is one of the most common things I get asked, or I get comments on the videos. You know, a horse will buck with a saddle, a horse will be biting or kicking or doing a behavior, and right away people want to jump in and go, that horse must be in pain. And I just want to preface those videos, first of all, by saying we make sure the horses are always checked out before I put a video in showing you guys a training technique. I wouldn't post a training technique knowing there was some physical there. We always get that horse checked out first. But aside from that, when you get called for a horse that's having an issue with something, what are you looking for? Kind of just talk us through your process of evaluating. Or maybe let's say you're there to treat the horse for pain and discomfort and you're helping them rehab, but you might think, actually, this might be a behavioral thing. So just kind of talk us through that process.
Yeah, I think that's kind of a loaded, complex question, because I think oftentimes pain can cause behavioral problems too, or patterns that the horse gets into that then, yeah, there was pain and there's behavior. So as we fix one, we have to then fix the other kind of thing. But generally speaking, when I get called for, let's say, an initial evaluation, I have a referral from a veterinarian to go see the horse. I'm doing a physical exam right from the get-go. And that includes watching a move, watching all their movement patterns that they're doing on the lunge line. I do a static exam where I get my hands on them. And even if somebody says, like, I think the pain is in the hindquarters, I'm palpating that horse and assessing that horse from the tip of their nose all the way down to their tail, even if, you know, we think it's in a certain area. And I'm putting that horse through a lot of different evaluations in terms of, what do my hands feel? Or I oftentimes say, like, I see with my hands, because they tell me so much. They're my most valuable tool I have. But I also am looking at range of motion, strength, flexibility, neuromuscular standpoints too, of like, how is the brain communicating to certain regions of the body, and what is their spatial awareness of their body. And that kind of is in a very, very brief nutshell, a whole kind of physical exam that I might do on a horse, and tasks that I might put them through that kind of help me determine, one, where is the pain, or two, is there even pain? And three, when you have a horse that might be uncomfortable and you put them through that physical exam, whether it be dynamic on the lunge line or under saddle, or a static evaluation, I can see a lot of what we might call behavioral things pop up too, like inability to stand still, or there might be horses that kick out to certain things that I might try and elicit or ask them to do. And it's hard to exactly define why I would think, yep, that's pain versus, yep, that's behavior. But it's me putting all those pieces.
Hey, if you guys are enjoying this interview with Emily, let me know in the comments if you would like to see more videos posted featuring Emily of Reaching Strides Equine Rehab. And don't forget to hit that subscribe button. So you're saying you're taking in the whole context of everything from what that horse was doing and how it was acting when it was. One of the things I appreciate that Emily does is she really likes to study horses in their pen, or in a stall, or just when the human's leaving them alone, because there's so many things that once we go into, like, we're riding them or we're lunging them, I think we're influencing that behavior a lot through training, and we can even cover some things up in that regard. But just showing what that horse's natural response is. I remember one time she pointed out to me that there was a horse in a pen, and I think we were having some trouble with the horse's flexion or something in the saddle, and the horse would go for flies on its right side, but if a fly landed on its left side, or I might be mixing it up, but the horse didn't really want to go for it. And she was noticing that in the pasture, and I was like, wow, that's that's a really great place to look, because that's where the horse is going to be the most honest, kind of with those things. But what are some things? Let's say that an owner is having some challenges with their horse. I don't want to get super specific about it, but what are some ways that they might know without riding it or being in some sort of riding or training moment with the horse? They might notice that it might be a pain issue. What are some things that they could look for?
I think one of the biggest things with pain is palpation. So like, let's use back pain as an example, because that's a really common one that I get called for. And that is also an area of the body that a horse may develop some behavioral tendencies towards, right? With saddling or a rider or something like that. So palpation, like how you palpate a horse's back, or routinely palpating their back, to know from day to day, from a day when they had no work to a day when they had work to the day after work, does that back feel the same? Do I get a different response out of them when I palpate? And one thing that, really kind of, in my opinion, it drives me a little nuts is when I see people palpate a horse's back with like their fingernail or a hoof pick, and they just run it down the side of their spine. I can make any horse look like they're painful with that. So good palpation skills, if you give me your arm, is thinking about steady pressure as we go down the arm or down the side of the back. Like you can feel me pushing, but not, my nails aren't pushing into you.
Yeah, it's not sharp.
It's not sharp. I'm using steady pressure each time I push, like the same level of pressure, which is subjective to me and how hard I push. But I can have carryover and consistency between every horse I palpate because I palpate them the same way. I don't ever just run a finger down like that. I don't take a hoof pick down like that. So palpation is a really great way to understand how your horse is feeling in that area you might be thinking is bothering them. Even in, palpating the hamstring or like the joints, like feeling, do I feel like this one's puffier than the other one? Or, just appreciating something. Because I think one thing that I would encourage everybody to do is just really get to know your horse's baseline.
So you're saying a non-professional could do this with their horse?
In simple terms, like simple palpation, simple, just general, is there swelling, is there not swelling? I think that people could, but that brings up my point of like knowing your horse's baseline. So knowing what they're like when nothing's wrong. Yeah. Like I was doing a podcast with someone else and they said, what are the top exercises you would teach somebody for their horse? And I was like, actually, it wouldn't be exercises. I would teach someone to really appreciate their horse's mechanics and their day-to-day posture and like really get to know that so that if there's a change.
I was going to say, I think it sounds like you're inferring getting this done when things are going well, not waiting until there's a problem. Get a baseline kind of assessment of your horse, really taking a close look at their legs and if there's any swelling in the joints or any kind of, because sometimes a horse can have like a little, I don't know if it's called a wind puff or.
Yeah, wind puff or like a little puffiness around
a joint that's there all the time. And so, if it's different, you got to become really aware of how your horse is kind of on a baseline. Yeah,
I mean, that's a really good point because change, whether good or bad, tells me a lot about what's going on with that horse. So really knowing your horse's baseline first. But if you're suspecting something, using palpation, do they react to my palpation that when I assessed my horse's baseline, they never reacted to that?
So generally speaking, what are some examples of that you would see this horse truly is in pain? You're saying, I think this horse is in pain. It's not, we don't need to ride them through something or whatever. What are some general things reactions that a horse would have if they're in pain?
Ooh, that's a good question because every horse is different in how they react to pain. But generally, you would see lameness if it's in the leg or something. That stride length would be off, or you'd see them almost looking like they're limping, what we would classify as lameness. I think the other thing you could look for is asymmetry, like it just looks different left to right. Other things you would look for if it was more centrally located, like spine or ribs or sternum or neck or something, would be like a change in posture, like maybe they're traveling hollowed out with the head up in the air. That can look like pain, or they're leaving the hindquarters out behind them because they really don't want to range their lower back. And then, of course, like your hands-on assessment, like, oh, they react direct palpation to that area that I'm suspicious of. They react painfully to that.
Yeah, because also like head up hollowing out can be a really common behavioral issue.
I know.
Too, when a horse is nervous or anxious, they go into that position, and they can cause themselves to be in pain eventually if that carries on. If a person ignores that a horse is traveling around with their head up. So that's one that gets kind of can get confused. But then you have to go to that palpation to understand standing still. Is this horse doing it? But it's like if that horse is nervous all the time, they're kind of spooky. They won't stand still. They're impulsive riding. Those might be some things that also tell you maybe it's more behavioral versus
could be
pain. So you got to put all this together.
Yeah, I mean, it's piecing it out. It's using your hands-on assessment plus your visual assessment of how they're moving and behaving to be like, gosh, that every time that owner pushes on that spot on their back, or in the rising trot they land on the back, and I'm just using back pain as a general example, that horse has a reaction. Or maybe it's in the rising portion of the trot and that horse does the reaction, and that might tell me like more of like, ooh, I wonder if there's a behavioral component to this, having ruled out saddle fit and things like that. But,
so now you're palpating them, and what are some responses you're going to get when you're palpating them? If they're in pain, it's like, okay, this horse is in pain. It's like you're sure of it. They're in pain. What are some of the reactions you're going to get there?
I mean, typically you'll see muscle spasm, or you'll feel muscle spasm or tightening under your fingers, like as you're doing your good palpation in that area. The horse, maybe if it's a leg, they'll try and jerk the leg away. If you're running down those tendons, and they'll be like, nope, don't do that. I don't want that. You might see them, go into that hollowed back, head up sort of position. They may kick out at you if it's in a hind leg and you're messing with it. Just like in the front, they might strike or pull it away. But typically you'll see muscle spasm underneath the direct area of palpation, and the horse trying to move away from you or get that leg away. You may even get to the point of like, I might try and bite you because I warned you and you're still pushing on it and it hurts.
Yep.
So.
Yeah. Now, what I think is interesting about that is she didn't say the horse rears up, the horse bucks, like they can do any of these things. But a little point that I want to bring to the table from a behavioral standpoint is a lot of times I think I see a lot of owners wanting it to pain to be the answer because they have no other way of understanding why the horse would do that behavior. When I know that when horses feel scared and claustrophobic, they can go to those behaviors very quickly. So I actually think some of those more dramatic behaviors usually come more from the horse being emotional. Now, again, not that they couldn't be in pain, but I think a lot of times when a horse will blow up and do like a really significant reaction, I think most of the time it's fear-based. The horse was very, very scared at that moment. Something was new. And I think that is common. I think a lot of times those lamenesses show up more like in the movement, maybe in the saddling or the palpating.
Refusal to pick up a lead.
Yeah.
Something like that.
But they don't just blow up. A lot of times I feel like I hear a story of the horse just, to the owner's perspective, the horse all of a sudden blew up and it must be in pain now. And and that's the way they're going to just fight. To me, that's kind of an innate pre-animal response if they get claustrophobic. And typically I think people miss some of the cues that was leading to it. Horse started getting a little faster, the horse's head started coming up, their focus got real strong on something else, the muscles started tensing. All that happened before the horse blew up, but it was heading that direction, and they kind of missed those cues. So I think people really need to realize that a lot of times when a horse is in pain, it's more subtle a lot of times. You know, it shows up in a more of a lameness. It's a little more acute than this huge explosive movement.
Yeah, I mean, don't get me wrong, like horses that are in pain that are pushed through it can go to that point in time, but hopefully we catch it before then.
Yeah, that's what I'm kind of saying is like, I think people need to look at the more subtle things. I think my thing is, because people come to us for different reasons, when people come to me, that when I might be like, actually this horse might be in pain, this might not be a behavioral issue, it's subtle. Like a lot of times it's like maybe the horse is just coming back to bite when you're cinching it up. or it's demonstrating a little bit of back sore, and you're trying to brush the horse, and it's like, oh, my back hurts there, and that's when I might go, hey, Emily, can you look at this? Or it's a lead. Horse won't get a lead consistently, or they're having trouble maintaining a lead. That's when a lot of times I pull Emily in to look at a horse. I do this all the time with her here. It's usually not like, oh, this horse is blowing up, bucking me off, or falling down, or something super dramatic. It's usually more subtle things. So I think a person that's trying to diagnose this really needs to, as you said, get a baseline assessment, pay attention to some of the little things.
Yeah. Well, I think then sending the question back to you is like, so say a horse comes in and you're evaluating it first. What are the things you did with it, maybe just generally speaking, that made it pass the behavioral assessment, that then sent it on to like, I actually think there might be a pain component here, or an asymmetry component?
Yeah. For me, that's a lot of times when I'm drawing from my experience and I'm going, this should be better by now, and it's not getting better, but I'm also not seeing asymmetry in the movement, and I think the movement is fine, and I'm not really, the horse doesn't seem off or seem upset about anything else, but maybe that lead is sticking or something. And that's where like they're having trouble with the lead, and it's consistently happening even though I've done the training techniques to set up correct leads, or it's having trouble maintaining a canter, and maybe it can maintain it on the right lead, but it can't the left lead. That's when I go, hey, Emily, can you look at this? And do I need to keep working on this and throw more time at it? Or is this horse uncomfortable here and they can't do more?
So it might not be that they passed certain tests. It might just be that they're not progressing.
They're not progressing.
How you would expect them to progress.
Yeah.
Okay.
I also think, when you're working with a horse regularly, like if a horse isn't sitting out in the pasture and getting pulled out once in a while, when you're in regular work, I think you're more inclined to notice a subtle change in something. Like, I think especially like if you think about our horses, who we've owned for years, training horses come in for a few months at a time or whatever, but our horses we've had for years, and we would notice, like, they could be just slightly off, and we would notice it. And that's where you would even pick up some like colicking or something. It's like they're just not acting right. They're not doing their normal behaviors. They didn't maybe come up to the gate to see us in the morning for feed, or they're standing somewhere awkwardly, or they're laying down extendedly. I think people need to really pick up on those things.
Yeah. Yeah. I think it brings up a point too, where we work together of like, how pain can create behavioral issues, and how we work together to navigate those. Because oftentimes I'll get in rehab horses. They're here for me to help them get back to their baseline, their prior level, or whatever goals we set with the owner. But I may have to do certain interventions with that horse in order to physically heal them. But there is a behavioral component now that is limiting me being able to do that intervention. Like, if we think about a horse with back pain, say, key thing you need to do with a horse with back pain is you need to strengthen their core. So it's that belly lift exercise or the butt tuck, and say the horse is super defensive to being touched there because they were in so much pain before. They anticipate the pain's still going to be there, or maybe there is a smaller degree of pain there or whatnot, but for their physical benefit, I need to do it, but I get big reactions. So that's where we come in together. So maybe we can talk about that a little bit.
And would you say that's where it really requires more of a professional looking into it?
Yeah.
Or my other question comes to mind is, let's say a horse had an injury of something that was a known injury, like a for sure injury, and developed. A lot of times, some of the worst behavioral issues come from a horse being in pain and being in a stall and being doctored, and they are in pain. But now we're thinking they're better. So
physiologically, the tissue shows healing.
Yeah. So let's say now you're thinking they're healing, but correct me if I'm wrong. But isn't a lot about physical therapy being able to mentally kind of override some things that, like, normally a person might only do this movement, but they really need to challenge that more? Because I hear you joke sometimes physical therapy, PT, stands for pain and torture.
Yeah, I mean, there's a degree of, like, you have to push through some of that physical discomfort in order to get the endorphin release or the X, Y, or Z that we're looking for in that tissue or that spot. So yeah, you have to kind of work through some discomfort. And of course, we would have ruled out or ruled in with the veterinarian that, yep, we can do those things. They can handle those things. So how do we do that now is the question. Whether it be we're allowed to hand walk now 5 more minutes, or, you know, I need to start doing core strengthening. Like how do we do that when it's turned into a little bit of an anticipatory thing or a behavioral issue now?
Yeah.
And so that's where we come in together to be like, all right, what strategies would you want to use, Ryan? Let's say a horse that needs hand walking that's been on stall rest. If anybody's ever done that, it's not fun. You know, I would ask Ryan, what strategies would you suggest using in order to help me accomplish this task? And he'll tell me, and then we'll have a conversation about, you know, I'll say, well, their restrictions are X, Y, and Z. So how could we modify that so that they don't, for example, tweak that injured tissue that we don't want them to tweak?
Yeah.
And that's a hard line. That's
It's
where
hard.
professionals need to come into play of like,
Yeah.
how can we do something without affecting the injured area or injured tissue?
Yeah, and I think this is where the point comes in of these things can be very challenging to work through, especially when it's, you know, there was a known injury, but now we've developed some behavioral issues, and now we need to know when to push it and when not to. And especially if it's like a really, you know, high dollar horse that we're really wanting to bring back to competition gradually, you know, it's like really important. It's not a horse that's just somebody turned them out for a year and so, well,
No,
we'll see how they do in a year.
These people have put a lot of time and money into their
this
horses.
is a long
and
road.
they
If
want
it's
them
had
back.
surgery, you know, you've got thousands of dollars invested in this program, hours and months and maybe even years of time. It can be really important. This is where I'd like to make the point that getting a qualified professional is really important. You know, with the horse training thing, you hear me talk about there's levels to this, and I'll use the example of somebody that's trained one horse or even no horses sometimes have a strong opinion that they'll share even in the comments of these videos what they think they would do. Then you get somebody who, and it's like if they've trained no horses, they can't even have an opinion. Like it just, you know, it's like you've not done it before. Now, okay, let's say you've trained one horse. Now you have a little experience. How about if you trained 10 horses? You've got more experience. How about you've trained 100 horses to do this thing that I'm showing in the video? You've now got a pretty baseline of experience. How about 1,000 or more horses? How about hundreds of thousands of hours? And so there's levels to the qualifications of an answer to something. And I know this is also true with your business.
I would speak to that in the veterinary medicine field of like, know the credentials of the people you have working on your horses. Make sure they're licensed. Make sure they've gone to
You're
a program.
saying non-licensed professionals would claim they know what to do with this? I'm setting this up because I know you get irritated when you see people that are non-licensed that are practicing some sort of thing. And I think there's a lot of people out there that they want to help the horse. I think they have good intentions, and they think they know the answer, but their information is limited on their experience and their qualifications, their education behind it. And so, what are some qualifications? What would you look for? Who is qualified to give this advice?
I mean, in my opinion, I would be looking for licensed professionals.
Like I gave you those examples of experience, but you know, trainers. I think in Europe you have to be licensed or certified.
I think in some countries you do.
But here you don't at all.
Anybody
can say they're a trainer. You could have no experience with training and you could be advertising yourself as a trainer. And I know people that do that. And there's also people that are starting out and they have the best intentions and they've went through some training. Maybe they've done an apprenticeship and they're starting out. But I would say, you know, a person needs to respect what their level of education is on something.
Agreed.
And the way to do that is by knowing your experience level, or by, as a client, looking for somebody that has a good reputation. They've been doing this a long time. That doesn't guarantee that they're really good at it just because they've done it a while. But really looking for a qualified individual based on good references, level of experience, you know, how many years they've been doing it, and that sort of thing. But definitely referrals is a good way to go by it. In the training world, that's kind of one of the baseline things is try to find, you know, 3, 4, 5 clients of theirs in the past and find out what their experiences were.
Yep. Yeah, I think, you know, from a behavioral aspect, when I run into a horse where I think that there are behavioral limitations, or maybe it's not physical, it's behavioral, I don't try and fix that because that's not within my scope.
Yeah.
I tell them what I think, and then we have that conversation about, all right, how do we find a good trainer or coach or something to help us with this issue?
Yeah.
So.
And a lot of times I think that's also really important in the beginning, because you can throw a lot of money at something before you really get down the right road. And I think finding somebody, maybe even I guess I'm saying like us, that can point somebody in the right direction. Again, we're not trying to solve the world's problems in this video. We just want to give you guys a little bit of perspective on situations that come up with pain versus behavior, and just seeking out qualified people to help you and know what your limitations are as an owner, and when to call in a professional on it. Again, you can use Emily and I as a resource. How can they contact you?
You can send me an email. It's emily@reachingstridesrehab.com, or if you contact Ryan, join his Patreon page. I also respond to personalized messages and video requests sent on his Patreon, so I can help you through there as well.
Yeah, so that's a great service. People can send us videos, and we can help you guys troubleshoot as best we can, even if you're at a distance from us, and hopefully get you headed in the right direction. So thank you guys for tuning in. Hope you enjoyed this video. If you haven't subscribed already, make sure you do it. We'll see you on the next one.